I'm extremely impressed with the crowd, and it's not only this much people, right? There are more people watching it in another room.
We have a transmission in another room, and we also are making live broadcast on internet. So.
All right. So I hope we'll have a very interesting 90 minutes together with you. And the reason why I'm here as the topic of my lecture is to share with you the art of the personalized smile design. And I'll walk through step by step to explain you why this is important and how you can simply apply it in your office even this Monday when you're with your patients. Just want to remind you something. You really don't need to make a lot of effort to make pictures or videos, because everything will be based on a very simple software which you can easily find all the details in that right after the lecture. So one thing, Florin, can we get these lights down on my face?
Sure.
So they better
Putem închide luminile? Okay, thank you.
Okay. So the thing here is that today we're in an era that it's impossible to understand which is fake, which is veneer, which is implant. For example, in this case, in such huge magnification, if I ask you if there are any restorations, a restoration or any restorations, even in this magnification, it's very hard to see that. And imagine this in a patient's mouth in a speaking distance, it's impossible to understand. And in this case, it's just a crown on a lateral, which was done by Christian Coachman when we were working together. And if you use materials like the pressables, the Emax, whatever, and apply it to these cases, I think the outcome is very, very similar to the natural looking teeth. If I show you this case, for example, and ask you if there's any restorations here, and I think the answer will probably be, we don't realize, we don't see the difference, but indeed, it's a very big case. The patient came out with a huge inflammation on tooth number 11, and throughout the steps, we treated this patient with an implant. So we're dealing cases like this, huge full mouth cases. And in order to get results like this kind of results, all belong to the before cases above the screen, we definitely know that we will need an interdisciplinary approach. And assuming that we did work in those cases like with 3 different ceramists, Kataoka, Ubasi in this case, and Christian on this one on your right, it definitely needs, first of all, to define your smile design and a very interactive communication so that you can run the whole thing smoothly. So when we are talking about this, we need to have a workflow. So most of the time, I listen to lectures. Okay, we talk many things about do it like this, do it like that, but what is important is that when you go back to your office, how can you practically do it? even communicating with a ceramist is an issue. So I'll walk you step by step on how we do it in the simplistic way and how to design the cases in a more reliable and repeatable way. So in the workflow, we all know that this is our basic workflow. So whatever case we work with, we apply these steps. And when we divide them into groups, we can see that in the beginning, this is what we always do. When the patient walks in, this is the data collection and communication. So what is this? Technically, it is a technical approach. And then, when it's an aesthetic case, we move to the other column, the design, which actually is the creative part of the whole procedure. And then we move forward. Depending on that design, we will dictate our treatment planning, whatever you name it, team meeting, offline team meeting, all these stuff that you need to take for proper treatment planning. You talk about the procedures, time frame, cost, because in real life they also matter. Once the case is accepted, then we go through the APT, tooth preparation, impressions. Again, all these columns are technical parts. You can even watch the YouTube and you can have tons of information on that. And of course, when we finalize the case, it's the control side for the patient, both in office and after the treatment. So in all this whole workflow, I think which will make you different than the other dentists is this one in the middle. It is the design part, it's the most creative part, it is the mock-up that you deliver to the patient. Because this is your first physical contact with the patient. They're asking for a better smile, and they have no idea. And even if you explain it for hours and hours, they will not get anything. Maybe a few words, but not the whole stuff. So mock-up in 3D, this is something you have to deliver to the patient. And this is a process of visualization. And what I see, unfortunately, not in Romania, not in Turkey, not in the States, that very, very little amount of dentists work with these steps. Majority of the dentists, they want to deliver an aesthetic case. The patient comes, they talk a few words, they make an impression, send it to the laboratory, and hoping miracles that the lab will come out with an amazing wax-up so that it will fit into the patient's expectations and hopefully will be the start of a successful aesthetic case. But I can tell you that many cases it doesn't work. The lab should have some parameters, the lab should have some other information, tons of information to give you the best wax-up. The ideal is doing a direct mock-up, which is not a very easy task. It needs some mileage, it needs some background, it needs some sort of intuition, which I'll share with you in a few seconds. So now here I can show you tons of before and after cases that we do in our daily practice every other day, changing these smiles. But why I'm throwing these cases is not because we're the superheroes, this is what we do, this is before, after, you don't need to talk about anything in between. Just on the contrary, I just want to share with you what we do in between to turn these cases into this aesthetic success. Now, what is important is that we have to see things, because seeing is completely different than looking. If you have more in depth of this topic, whatever topic it is, you start seeing things in depth. Like for most of you, when you open the engine of the car, it's just metal blocks and some pipes. That's it. you look at it. But when a mechanic looks at it, he understands tons of things from this configuration. Leak of oil, whatever. So seeing is knowing things better than the average people. For example, I saw these things and it was very affecting for me. This is a FedEx logo. And this is what I've been seeing, looking at since years. Until I learned that within that logo, there is this arrow hidden, meaning that we go directly to our target. Or in Amazon.com, this arrow here, meaning that we deliver everything from A to Z. Or in this Tour de France, it's the biggest bicycling race, you know, in France. This looks like a transcript, but when you start seeing in depth, you see that there is a guy riding a bicycle. So there are these hidden messages in those designs, and we should have these hidden messages in our smile designs, so that without knowing the reason, people will fall in love with what you created in their mouths. So coming back to these 5 cases I showed you before, these are the pictures before we started the treatment, and these are the after full face pictures. And why I selected those? Just because for some reason the patients felt in love with these outcomes. So you know, there are some cases they're okay, some cases which you say okay, but it could have been better, but there are some cases which you and the patient say, wow, this is unbelievable. So this is the cases, these are the cases where the patients gave that kind of a reaction. Now, what is interesting is that when I start showing the after pictures below now and bring it to the whole screen, we'll see that they are not alike. They're all different. Now, tell me, in the best case scenario, did you ever prescribe anything, let's say for a wax-up or when you're doing the mock-up, about the incisal silhouette, incisal projection of your smile design? Why? Because the one on the left-hand side, it's rounded. In the middle, it's triangular. And like on the right-hand side, it's like flat to rounded, all different. What about, in this case, the tooth axis? Look at this. Here, this is a straight canine. On this other one, it's an inclined canine. What about, what about the dominance of the centrals? Like in some of them, they are dominant. In some of them, they are like medium dominance in that smile. And finally, what about the shape, individual shape of the teeth? In one of them, it's rounded, this is rectangular, and this is triangular. So in a split of a second, when we start seeing things in depth, we'll see that in these 5 different smile designs, there's like multifactorial different things, minor things, which made this design look very, very personalized. So how in the world am I going to get into depth of learning this? And this is what I would like to share with you today. Our journey with the whole stuff starting in 2004 with Braulio Paolucci, an amazing dentist from Brazil, and Adriano Scheider, an amazing ceramist, which we had the opportunity of working for years, both in my office, back and forth to Brazil. And what we did is we tried to figure out what can be behind the patient perception. So we started with the personality traits, which goes back to Hippocrates, BC 400s, and even then, thousands of years ago, he defined the personality traits. You don't need to know any detail on this, but amongst all, he divided the major groups into 4, being strong, dynamic, delicate, and calm personalities. Of course, it can be a blend of one or two, but basically, this is how you are. You can be a dynamic person, you can be a calm person, you can be a very strong-looking person. And then our second stop was Carl Jung. Going back to his last years, who happens to be the psychiatrist of centuries, that's how they name him. What he did was, in his last years, he walked around the world. He met people from different cultures, from different backgrounds, different religions, all these kind of very, very different people. But he found that even in that diversity, there are things similarly perceived by people. For example, is it going to come back or? Okay, or do I have to stand here? When I move, it disappears. So he realized that there are some symbols which are received the same all around the world. As simple as straight lines, vertical lines representing strength and power, horizontal lines representing stability, inclined lines representing dynamism, and rounded lines representing suavity and delicacy. But at the end of the story, we saw the similarity that even in his research, all these visual language was divided into 4 groups: strong, dynamic, delicate, and calm. And these are not our findings, but these images like the square, triangle, ovate, and rectangle in psychoanalytic language, these are the shapes which are accepted to be representing strong, dynamic, delicate, and calm. And then when we moved into our main topic, we saw that an artist called Philip Hallowell was the first one who defined this visagism concept and applied these figures into his art piece. So what happened here is that he started drawing the portraits, and by using square, triangular, rounded, or rectangular faces, he tried to find out if they represent the perception of understanding the facial reading. And he realized that, yes, if it's a rectangular square face, it's a strong-looking face. If it's triangular, it's a dynamic-looking face. And then this is where we went into. We also realized that the natural teeth form, rectangle, triangular, ovate, or square, it also exists in natural dentition. And also with the tooth, the teeth that was appearing in the mouth. Why is it? Okay. It's not advancing. It's advancing here. Maybe I'll pass my laptop hand to hand. It will be. So when we saw these similarities of this visual language, we started discussing this with psychologists, neurobiologists, anthropologists, and sociologists, and try to see if there's any truth behind it, or is it just the perception. And we really wanted to see the relationship of this facial and personal perception with the design of the smile. So the concept we hoped those days that would work would be a combination of the personal traits and Philip Hallowell's visagism concept, together with Carl Jung's visual language, and then blending these all and see the reflection of this as how we can get the patient perceived as they want. Now, these are like very interesting things. So here, visagism is all about how the patient wants to be perceived. So in this picture, we see a nice guy on the left side, a nice lady on the other side. But in real, when we get these together, it's the same person. And now you can see that the way you want to be perceived differently, you can handle that. Look at these pictures. What do we see here? A lady 60 plus on the left, lady 40 plus in the middle, lady 20 plus on the right. But when we see them with a different perception, it's completely different. So this was our trigger point. We said if people can manipulate the way they will be perceived, why can't we apply this into aesthetic dentistry, into our smile designs? Why can't we be few steps in front of all our colleagues who are really trying to do better and better smile designs? So as I told you, our project started in 2004, and in the later 14 years, we went through 600 full mouth cases, both Braulio did in his office and we did in our offices. And amongst them, we selected like probably 100 plus wow cases. The cases we did, we loved it, the patients loved that. And through that, we would want to see what makes this important for that patient. In other words, we fragmented that. Well, until that time, I'm a huge fan of a direct mock-up. This is probably the best thing I do in my dental life. So I've never seen any patient saying no after I do direct mock-up. But having said that, it's not an easy task. I do probably 10 mock-ups every day, just for fun, even if I see it, because it's for my advancement. But in this case, with a peg lateral, for example, again, I will immediately start treating the case with a mock-up, first the centrals and then the rest of it, and this is what comes out. And what is, even though it looks great, what was my force on how I did this design? Well, basically, the way when I do a direct mock-up, these are the things behind it. I use my imagination, I use my intuition, I want to see the perception, the patient's expectations, how to personalize it, proportions, emotions, and at the end of the day, lots of creativity. And collecting all these things is not really the easiest thing. So we said, what if we do it in a different way so that we'll find out what the patients like? So even in that case, I did a very, very accepted mock-up. We sat with Adriano and say, for some cases, for the startup, let's do 3 different wax-ups. And look at these. These are, all 3 of them are beautiful. I mean, if I were to be the patient having one of them in my mouth from the beginning, I would say, wow, this is unbelievable. But we wanted to see, is it because we only give them one choice to select for the smile design? And what if we propose them a few? Are they going to select one of them more than the other? And for sure, it worked like this. They said, okay, they all are great, but I like this delicate smile. And then these are the final results, but then that drove us into a path on trying to see what make it valuable for the patient. So I love this saying, creativity is allowing you to make mistakes, or better to say in our case, trials. But the art form actually is knowing which one to keep. This mistake is never a failure, it's a learning process. So we eliminated all the things throughout the path we learned, selected the ones which the patients loved, and tried to come out with the art of a personalized smile design. So our first project was the Visage smile, and in this Visage smile concept, we tried to figure out which parts of this smile belongs to what part of the patient. Is it facial driven? Is it personality driven? So as we start making cases and keeping the charts, we came out with some results. So I'm not going to get into the scientific research part that took us 14 years to sort of perfect it, but rather than how to use it in your offices when you go to your office on Monday. So we have a few steps to continue with. The first step, and again, you don't need to make any records of this because it's already done. The first part is to understand the geometric analysis of the face. And in doing so, we, in the beginning, use all these basic points on the face, which psychoanalysis had been using since years, and try to figure out the facial perception of that patient. Meaning that, how will you perceive this face? Is it a strong, is it a dynamic, it's a delicate, or a calm face? Just like Philip Hollowell did in his visagism portraits. So this was the first step. The second step was to go through the interview and try to understand the personality traits of the patient, whether it being strong, dynamic, delicate, and calm. And then as we eliminated case after case after case, we realized the relationship of these with the main frame of the smile, and then later on the individual tooth shapes that we have to place in the patient's mouth. And then when we put it into digital form, that speeded up the process like rocket time. But the base behind that was the recognition of the face and the personality of the patient. So throughout the algorithms, now the software can give us thousands of choice, selects the best for that patient, and finally you will have a design. And when you see the after picture of that patient, you'll see that it is dependent on the facial perception and the personality, and this is the design that the Visagist smile will give me. So we start working in a different level once we started getting this Visagist smile design, and that's what you're seeing here, so that this after picture is never coincidence. It was planned in advance, and this is how we came to that result. So for the eyes who is seeing this design the first time, may not mean something serious, but what I see when I look at the design when it comes back to me from Visagist smile is that it tells me exactly about the incisal silhouette, which is the same on the patient's mouth. It tells me exactly about the dominance of the centrals, which are dominant. It tells me about the tooth inclination. This is how we design the canines, and the individual shape of the teeth, which is triangular, the final design. So having these clues in my pocket, it was so easy for me to start doing my direct mock-up, sending it to the lab, them doing the wax up, and then the porcelain afterward. Now let me walk you through in a simple case, and then we'll get into more complex ones, but easier to do cases. So in this case, this is a trauma case. When you have such a case, you have an empty space to be filled because there is no reference from the adjacent tooth to make it look alike. But in this case, we have to fill the space that's missing in that zone in the patient's mouth. So first, we don't use it anyway because the software advanced with its second and third version. But in the beginning, that's what we were doing. Placing the picture into the software, it was automatically reading the face, giving the facial analysis. And when it was doing this with the facial perception program, it was by itself automatically dictating these points in the face and then giving you about the facial perception. So she is more like a delicate looking face. This is, in this calculation, 58%, and the dynamic part is the secondary. So when we look at the face like this, we see something, a mixture of mainly delicate and dynamic. The second part was the questionnaire about the personality test, and this is something we invented. this is the personality test that all psychoanalysts still are using, the most reliable one. And on the third part, it's the either patient's or dentist's special choices for that smile. So we can get a design like this. On purpose, I placed another design here just to show you that every single design that comes out from Visage Smile is different. Anyways, with that, the drawing tells me that the facial outcome is delicate and dynamic, making the incisal silhouette slightly rounded to triangular. So it's a great point for me to start doing my mock-up. Secondly, it tells me medium to dominance centrals. So now I know the difference that I need to create between the central and the lateral. And then we know that the tooth axis will be slightly inclined. And throughout the personality trends, I know that I need to make the design individual tooth shape like triangular to trapezoidal. So with this information, when I do the mock-up, it's exactly what really fits into the patient's smile. So with that, the rest is so easy. This is the first day when I did the direct mock-up, and then when we make the final impressions after the teeth were treated for a couple of weeks. Now these are the veneers after a couple of weeks, try-in, and 2 months post-op. Now, how did I come to this result? Actually, let's see the relationship of this with the Visage Smile. So the best way to understand is to superimpose it. So I'm just bringing them on top of each other. This is what I was given through the Visage Smile, and behind it, it's exactly the same copy of that design with the final porcelain veneers. And this is the look of the case. So maybe for some of us it's not that impressive, but what I want to impress is the patient. And when they feel like this smile belongs to them, it's a different story. It's like simply, mostly for the ladies, let's say you have like 30 shoes at home, 50 shoes. I'm trying to be very modest. And amongst them, I can guarantee you that there's like 5 or 10 favorite shoes that you wear all the time, and the rest just stay there forever. So with this concept, we try to really understand what you love. And we want to buy you shoes that you will wear all the time. So this smile is very similar to that concept. We can use it with implant cases, for example. Now, let me walk you through this case, and you'll understand where we use it, how we use it, and then I'll switch to the next level, which will automatically do everything for you. This case was referred to me by an orthodontist, and in this case, she had missing laterals. Of course, most of the time, the easiest way to go is to close the space between the central and the canine and prosthetically convert it to laterals, which I don't like because the root shape of the canine will never give that delicate effect there. And hopefully, the orthodontist picked up the choice of opening the space for laterals and then maybe for a possible implant work. So the patient is in my office after 18 months, and this is the condition. So look how extremely narrow the space he created, even though it's a huge difference between how he started versus where we are now. But still, if I would be in command of the case for the time being, I would want him to move that a bit more. But as I told you in the first workflow, there's also another entity in the whole process, and it's the patient. So patient got a huge business offer She's a model. She makes her life out of modeling. And they ask her if she can improve her teeth, she'll get the contract, and she had like a year. So when I talk to the orthodontist, moving them, pushing them slightly apart means pushing the back teeth back, further back, will take another year minimum. So we didn't have that time. And then we decided to go, okay, let's see what we can do at this stage. And immediately we make the pictures, even if the patient had braces, put it into the Visage Smile program, went through the interview, and then that gave me the design. And behind that simple two things, there's a very complicated software which consists of all these issues relating the face to the structure, relating the interview to the tooth shape, their combination with the dominance and the details, whatever the patient is asking for. And it gave me this design. So before we even removed the braces, this is what I got. At this point, I needed to see where to start with. So it already gave me all the details. The facial structure of this lady is delicate, combined with a strong look, but mainly delicate, which tells us that the incisal silhouette should be slightly rounded. Then what else does it give me? The tooth axis. It has to be straight. What about the dominance of the centrals? Medium to dominant centrals. And then finally, the individual tooth shape, patient being more a calm person and a delicate, so it will never be a triangular shape, which is very dynamic. So it will go down to square and rounded. So it will mainly be square with some slightly rounded shaping. So basically, this is what I would get. Now, because I did tens and tens of cases like this, I can immediately see what this means. So in that case, what we did was, in the beginning, even though she has the braces, I'll still be using my Visage Smile design, but in this case, I'm limited. Limited as up to the level of the braces. So I can only use the incisal 1/3 of this design to see whether I can handle this case if we take out the braces or not. And as you all know, the very, very first step of starting any aesthetic case is the incisal edge position. Not only vertical, but also horizontal. So I'm trying to see if I can get that silhouette, then okay, we can handle the rest of it. So this is what I'm doing in my first session. I'm just taking my flowable, I'm adding into the incisal edges of this case. What do I do here? From the Visage Smile, I make the centrals slightly more dominant. I make the smile curve flat to slightly rounded. I cannot control the tooth axis now, but I can control partially the shape of the teeth, which is in the incisal third, square to slightly rounded. And this is what I do in less than a few minutes, placing the flowable and getting into that level. So the more the patient smiles, of course, the uglier it will look because I had no control of the rest of the smile. So at this stage, when we decide to take the braces out, and this is how she looks now, this is the time for my second mock-up. And this has to be more realistic because this will guide me on how to work on this case. Now, we all know that the way, let's say, my parents were dentists, both of them. And when I was watching them, when I was a student almost 40 years back, I was seeing that the priority was always biology. Most of the patients would come with a pain, swelling, bleeding, And this is what they would try to solve. And then structurally, with the limited amount of materials, they will try to replace it. Function, most of the time, very locally functionize it. And then aesthetically, who knows? Now, it's completely changed, especially in the treatment planning. Because whatever you do, if the patient doesn't like the aesthetic outcome, that case is a failure. They don't care whether you did the most difficult comprehensive implant therapy, preps, whatever, but if they don't like the smile, you're dead. At least in my office. So I always try to give them the possible final aesthetic design, and if they like it, then I want to start walking backwards. How am I going to set the function according to this design? What am I going to do structurally? What materials should I use? And biologically, how am I going to fit it into the environment? So this is what we do, starting with the mock-up on your left, taking the braces out, and then applying the direct mock-up with this Visage Smile design. So just a small portion here, not related to Visage Smile, but related to anything you do. This is the way we always communicate with our team. So don't think that you have to have an office like Florin's, amazing office like Puyu's, that all the specialists work in your office, everybody is together. This is the ideal, but you can still work on a solo office and work with the adjacent auxiliary people like orthodontists, periodontologists, implantologists, but you need to have a way of proper communication so that the patient doesn't become like a ping pong, go back this and what was this? Well, no, you have to have a solid foundation. And this part is the one I found missing in most of my colleagues. So this is simply what we do. I know that, like, I can work with Christian, Adriano there in Brazil, different time zone. I know that my orthodontist can be in another place. Eric, in this case, who did the implant, is in Belgium. So instead of just trying to call them and say, wait, what do you do? What do I do? I first make an offline treatment planning session, which means this is the planning session that we design the case, or I put my questions into there and just fill this up. I make a very small keynote presentation, and in this keynote presentation, I just start recording the screen with my sound on, and I don't know if there is sound here. It was my fault. I said no sound, but whatever, even if we don't have the sound, here I'm explaining my worries, my expectations, like the tissue loss, whatever we need to make. And you see the pictures. This is what I'm presenting you. It's nothing different than that. Just making a very short video of like maybe 30 seconds, showing the critical pictures, asking my lab, Hilal, who is here, Eric, about the surgical part, just giving them the taste of the case so that in our next meeting, we will discuss the case into depth and come to a final decision. So if you say, this is too complicated for me, I don't use laptops, I don't use Keynote, it's, okay, use this. All of you have phones now. You don't even listen to me, you just go with your phones. So this is what you will be doing. Get the pictures in a split of a second, create a group, you being the admin of the group, whoever who is in charge of this treatment, create your group for this case, and then get these pictures, and you can even voice on. So that takes no more than 5 minutes. And if you're not doing this, the only reason is that you don't want to do it. Otherwise, this is the simplistic way of communicating with the whole team. So there are some sophisticated 3D PDF files. I mean, now all the companies are into that you can send it so that the team can see the case in 3D. And nevertheless, this is what we ended up after ortho. So the planning here will be dependent on also the CBCT. And we can see that there is a huge bone loss on both laterals, depression. The lucky part we had was that vertically we had enough bone, because horizontally there are so many ways to recover it. So after the whole team discussion with Skype meeting, the decision was that we will be placing 2 implants on the laterals. We always use MIS, but also the choice here was that MIS V3, the new triangular headed implant, which fits amazing, especially in that kind of cases, which is not immediate extraction. It works great in those cases, but if you have solid bone, it just goes into a very narrow space so that you don't lose any of the bone. And then we use 3.3, very narrow, because the space was extremely narrow, but a long one, 13 millimeters. Meanwhile, we'll be doing some soft tissue augmentation because of the loss of soft tissue, and we will go restorative from 15 to 25 with veneers only. That was the treatment planning. So the first step after my mock-up goes to Hilal, our ceramist, and Hilal is doing the wax-up according to what I gave him as a mock-up, but in the background, the Visage Smile design, telling him about the inclination of the teeth, the dominance of the centrals, the individual shape of these teeth. So once he does it, once the wax-up is ready, this is a little too fancy, but since we have it, we will take this impression into a 3D scanner for the reason that I want to create an individualized impression tray just like this. And then when you fill it up with silicone, because this space is so narrow, it becomes very rigid, and the shape of the mock-up or APT, I would say, comes out amazing. You can do it with alginate, but with alginate there will be a lot of excess which the patient wouldn't understand what you're actually designing. And look at here, it's perfect. Look at the margins. The only thing which is not perfect here is the laterals. There is some excess there. So why is that? I made the best tray, best impression, best transfer. Well, the reason for that is that, remember, we had a tissue loss there. So regardless of where the tissue is, because we're following the aesthetic design only, Hilal designed the lateral with the correct vertical inclination. If he would start the design from the soft tissue, it will look like this, flared out. He doesn't care about it. He uprights it, and then that space you're seeing here, which I'm trying to create the shape of the teeth, will be filled during the surgery with some soft tissue grafting or with an artificial grafting like O6 Volumax, which you don't need to take the soft tissue from the palate, just fill that space out, which works amazingly well as well. So now I'm correcting this, but at this time, even though this looks amazing for me, I get juicy, but the patient still says, why is this tooth so upfront? And for you, the fastest thing to correct it is to apply some pink wax or pink composite into that zone so that she will understand that when we will be doing the soft tissue grafting, that would be the final look of her smile. Okay, so now I have something extremely solid in my hands, because what I achieved here is the part that we all agree with the patient that this is the aesthetic design both she and I want. So this is a great, great step, because without this, again, I'm repeating you, I don't care what we do for all implant placement. If this will not be the final result, she'll always be unhappy. Now it's our team's work to work on this backwards and decide where to place the implant, how much soft tissue augmentation to make. This is the right way to go. In most cases, I see that, okay, there's a case with laterals missing. George, I'm sending this patient to you, place 2 implants, send it back to me with no plan, nothing. Osseointegration is different than the aesthetic integration, because now I can control whether it will be screwable or not, and I hate to go with cementation, whether it's gonna fit with the position of the teeth or not, and this is all the planning we make in advance. But the startup of this whole stuff was, in this case, the Visage Smile, dictating the incisal edge position, walking backwards. So now in this case, everything from here on will be prosthetically driven, so that the planning, the guide planning, the surgical planning, the lab planning will always follow this, what we have. And having said that, why is this so important? I mean, these are very small details, but this is what makes you look better than the other colleagues. So let's say, in this case, we decided to have more of a squarish to rounded teeth. And the zenith point will be different if it were to be a triangular teeth. So this zenith point, as you see here, it's not only vertical. It doesn't say, yes, it should be like 1 millimeter shorter than the lateral, 1 millimeter shorter than the canine, V-shape. No. On top of this, we have this for all 6 dimensions. This tells me where the zenith point should be facially or palatally. It tells me whether it should be distally or mesially or vertically up or down. So with this, now I will send this case for a guide. Let me tell you something. Even though I'm working the best implantologist on earth, Puyo is one of them, Nicolescu, Eric Van Doren is another one, Junaid is my surgeon since 30 years we work together, but still I can tell you that they all use a guide. I don't care if it's MIS, if it's other brand, but this gives them an extremely precision way to position the implant. And in this case, if with any brand you want, if you want to have a guide, these are the 3 things you have to provide. One is the 3D STL file of the existing case. The second one is the STL file of your mock-up, because that will dictate everything to be positioned, and the CT scan of this case. Now, when this goes to the center, again, I don't have the sound here, but you can see on the right top screen that we can always see the mock-up versus the original position. And when we're deciding on how and where to place the implant, it's not only how vertically deep we will be, but the angulation, mesio, distally, bucolingually, and vertically. So this way, it will be a very precise way to go. So the green refers to my mock-up, and with a touch, you can strip it off. You see the original, and this way, you decide. And in most of these sophisticated guide programs, it already tells you which exactly abutment you should use at the end of the treatment. So it's like living in heaven. The only thing you have to do is the perfect prosthetic setting before you get into these details. So this is what I get from MIS, the prosthetically driven M guide. And they send it in two pieces. One is the stereolithic model of the original mouth, and on top of that, you see here, it's the guide itself. Now, once we have this ready, before we start the surgery, we have a few more steps to put into to be on the safe side and to relax instead of just running around what to do during the surgery. So one of the things is deciding on the provisional. So when it comes to provisionals, my question will be, am I going to immediately load it, or is it going to be delayed loading? So why is it important? Well, because I need to go in a different way. If it's like immediate loading, I would want from my lab to prepare a crown. If it's like delayed, I would ask for him to do a Maryland bridge. So at this stage, Hilal came out with this idea of making something different, which can be worked with in two different ways. So this is a provisional, sort of a Maryland bridge, but the bridge pontic here is empty. This side in here, it's empty, so that we can use it for two ways. If it's going to be immediately loaded, we're going to use this as a crown. If not, we'll fill this up and use it as a pontic. That's simple. So one other step we did is that I told you we got the stereolithic model of the original mouth and the guide. So Hilal starts using this guide way before surgery. How? Just like this. First he does his Maryland crown, bridge, whatever, and then we go through the whole of the guide, and when we open this hole on the stereolithic model, you can see here, now we have a model waiting in the lab which the implant socket has already been identified and ready. So when I'll make the capturing or impression from the mouth, I'll immediately just put it there and that's it. No hassle, nothing. So this is what we do before surgery. And in surgery, you had the chance to listen to Eric and Florin, I guess, yesterday. So Eric starts the surgery with a soft tissue graft that he takes from the palate of the mouth. So we have amazing periodontologists, implantologists in the lecture circuit here. I don't want to get into detail. He knows what he's doing. But then the next step is going exactly through the guide. In that very narrow space, I think this is the only way you can go. Then Junaid takes over because we don't want to lose single dime of bone. So instead of just expanding the bone, he uses the condenser to enlarge the hole. And after that, again, with the use of the guidance, we place the implant, the V3, into the position. And when we look at the X-ray, I think this is like as precise as it can be. And they all admit it. They said without the guide, luckily it would be like this, but never repeatably in every case. So this is the implant placement. Now I get the green light for immediate loading. And what I will do now is in that Maryland crown bridge, I will open the palatal surface of this unit, simply position it on over the implant, and the wings, I don't cut them yet. Why? Because if I had only the crown, I wouldn't know how to hold it. It could have been like this, like that, short, long. But this wing stops it in the position where it should be. So using the wings as a stop, I'm capturing this from the palate, meaning that I'm emptying the space, adding some composite there, as you see here. And once I'm okay that the Maryland is attached to this analog transfer, this is it. So this is what I get. Now, what do I get here on top of this in the laboratory is that since I have this hole prepared in advance, when I seat this Maryland on the teeth in the model, I'm exactly at where the implant is. Technically, I don't even need to make a final impression, which I will, but technically you can proceed like this. So you fix it on the inside of the model and work with whatever design you want. Pink, white, you decide it. The critical thing here is that the relationship of this zenith point to the tip of the abutment. This is what I need to correct in the lab, and this part, the soft tissue, is what Eric has to do chair side as I'm doing this in the laboratory. So he's positioning the soft tissue graft into place, creating this bulky appearance, and after 4 months, this is what we get in the patient's mouth. Nicely scalloped sockets and nicely scalloped gingival architecture. Immediately we make the impression, we transfer this into the laboratory. Tallinn is doing this transfer, and then this is what Hilal provides me in the lab. The only difference is that the design of this abutment on the left is not standard. It's like almost a full crown, because I want to finish my whole thing as veneers. So in the prosthetic phase, when I position it in the patient's mouth, it's like an unprepared tooth structure. So how am I going to use this? I'll use my standard prep through the APT technique. I will place my mock-up on top of them on the second stage like this, and then through that I'll prep anything regardless whether it's an implant, abutment, tooth, because that dictates where I should be in the prep side. So when you look at it, it's really minimal invasively prepped. And on top of this impression, now Hilal is doing the wax up. And then finally, this is the micro layering technique, which he does amazingly. Small cutbacks, small additions, and it makes look like extremely real. And these are the veneers, and this is the prepped abutment like a veneer. So this is the X-ray we see after we screw the abutment in, and look how precise it fits there. And then let's see the comparison between how we started and where we are now. So this is the flowable I placed in the patient's mouth day 1 with the braces. And this is what we ended up after the porcelain. Now, because they are both mimicking what we had as the Visage Smile design, this is exactly how we ended up. The biggest difference is that now, the more the patient starts smiling and the lip line goes up, the more beautiful it looks compared to where we started when the patient had braces. So this way, we managed to set everything in the right place, being prosthetically driven, and towards the end, with all the soft tissue, there is no more depression on the laterals, all fitting in the best place. And these are the steps, before ortho, after ortho, and this is when we're done with that case. So at the end of the day, it's not like beautiful smile, beautiful day, but it really had a great impact on her life, I would say, because now she got the offer she was given, and now she's all over. And it's very nice to have there with your face, with the most suiting smile you have on your face. Now, this is never a one-man show. I'm talking here, but all these people, Eric, Cüneyt, Tallinn, Mürvet, Hilal, part of the team, and you cannot run cases like this without team. And the thing is that how to communicate with the team. And this is the most important part. Now I'm switching to the last part of the lecture, which is the most advanced part now. It's the Rebel. So I told you about our team, Braulio, Adriano, and myself. And with the addition of Dimitar and Georgi from Sofia, which, by the way, is the IT place in the world, I would say, even faster than the Silicon Valley, we further advance this Visage Smile concept. Why? Because this was the way I would work. I loved it. But the problem is that when I start seeing my friends trying to use this from all over the world, even though this design was digital, we didn't have to think about anything, still the mock-up was manual. And not everybody is that comfortable using this kind of a direct mock-up. So instead we introduce Rebel, which is actually giving you this 3D digital, 2D digital design, but converting this into a 3D STL file. And you won't believe how precise it works. So immediately we'll get this 3D STL file, which can be applied to the patient day one, and this is the best design, best wax up the patient can get. And it's really very standing on the feet type of project. So what it is doing is that instead of this Visage Smile, even though the base is Visage Smile, it's converting this 2D with geometric polygons into 3D and giving you the shape that is needed for that smile design. So when we're doing this, we also have some additional features because this is using a huge artificial intelligence program, combining all the best looking cases I have done trying to understand how we did it, from Braulio, from Dimitar, and the cases we selected with the Visage Smile concept. And what is interesting is that, let's say in a patient we have mostly calm design, which is like a rectangular design, combined with delicate, which means some rounded shapes. So from the digital library, whether it be natural or from a ceramist, it picks up what we do here in Visage Smile is that we drag it, and I have the understanding, but at the end of the day, it was my hands to convert this into 3D. But in Visage Smile, automatically chooses the different shapes, and in advance to that, like in this case, it takes the square teeth, thinks about delicacy, and starts morphing it. So out of that, it gets the best shape, which doesn't exist in any library because all the shapes are standard. It picks up the best shape and then puts it into the design. Now, let me walk you with a few cases to briefly explain you how this works in my last 20 minutes. So this is the patient who wants the whitest teeth ever, okay, who resisted to have ortho, not okay, and I forced her to get ortho, then she accepted. So this is how we started with a small, I don't know, probably 8 months of Invisalign treatment. Now the teeth are aligned properly, and this is the smile we want to convert. Okay, let's say I'm lazy. Let's say I cannot do the best mock-up. So with the Rebel, I think, which is based on the same concept of Visage Smile, the only thing we have to do now is to mock up only the two centrals. Tell you the truth, one is enough. Tell you the truth, you never have to make the best design. The reason why we do one or two mock-up on the centrals is to exactly define the incisal edge position, because the rest will be done by the software, but we have to be precise on the incisal edge position. So this is what I did. I'm doing these mock-ups, smiling, whatever, and I'll show you a very, very simple photography protocol. Once we do this, send it to the Rebel, and I'll tell you the steps, don't worry about missing anything. It first makes this Visage-Smile 2D design, and immediately Rebel starts converting it into a 3D design, and on top of that, by morphing these teeth into the ideal shape that they should have been. So once the design is perfected, it always checks it with the facial appearance of the patient, and out of this, technically, you will never get it in 15 minutes, but technically in 15 minutes, the STL file is ready. And this STL file electronically is being sent to you just by a simple email. What you have to do is to see on the left the 2D design from all aspects. They can send all these pictures. But more importantly, like on the right, you will get this beautiful STL design, which you can check through here. But better, you will just drop and drag it into whatever 3D printer you have. And depending on the printers you use, probably within the next 2 hours, you'll have an amazing 3D printout of this aesthetic wax-up. So this is what you will get. And then here, what you have to do is to make an impression of this 3D wax-up, just like as if you received a normal wax-up from the laboratory. So you position it on your tray, you dip this impression into the tray. Better not to have a perforated tray so you can pull it out easily. And once everything is set, then we will take the impression from the tray and then the model from the impression. And then basically start shaping the margins. It's just up to you on how precise you want to be. So these are the basic steps that you will do after you get the 3D printing. And if you say, I don't have a printer, almost every lab has a printer. So you can send this STL file wherever you want and they will print it for you. Now, once we have all this setup ready, we will simply go with the application of this. Why is it not advancing? Application of this into the patient's mouth, just like we see, just like, oops, we do the regular APT transfer, and this is what we do. We load the tray with Luxatemp. This is my winner material since been using 20 years. And look at this. Once you take it, it's the unbelievable design that comes out immediately. And you don't need an intermediate great ceramist to do this wax up for you. So once we have this, the patient can see that. You can communicate on that. I can tell you with my experience, 80% of the cases it's slam dunk. But in this remaining 20%, all you have to do is like very minor adjustments. If this came out short, you can add some flowable. If it's long, you can shorten it. But no major changes would ever be needed. So this is the patient with the APT. Once we have the approval, I'm not getting into details on how to prep through the APT, but in every single tooth, we use it. I don't know, Elif, you were with us when we came out with this idea. By the way, we have great Turkish friends here, and Elif was one of our associates. We worked since years, and she was in the team when we were developing this APT technique, so thanks again for helping me out with that. And these are the most minimally invasive preps. Now, you have the choice of either going with a pressable ceramic or using the same STL file slightly modified to be used as a CAD-CAM. So if the patient was extremely happy with the outcome, just mill the porcelain teeth out of the same STL file, superimposing the wax up over the prep design, and that will be the final design. So technically, you can start this case in the morning and easily finish it in the afternoon. You won't, because Rebel doesn't deliver it overnight. It takes 2 days. But what I named this is like the sophisticated simplicity. Just like the Uber, for example. I think it's the simple application for the end user. You just click on it so smartly, it finds out the closest one, blah, 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 you know all the stories. And same for Rebel. I mean, you only have to place the composite on the central, boom. Then let the artificial intelligence get into designing the teeth, get into, and give you this very sophisticated design over the end. And when we follow this from left to right, you see the changes from the before to after when we do the Rebel design in that patient. So if we want to summarize the steps, first we get the face recognition, then we go through the questionnaire, then we do the mock-up on 2 centrals, pack this up, just send it to Rebel, and it's now automatically being sent. This was the old version. So Visage Smile design, conversion of this into 3D, coming up with an STL file. So in your office, it's going to be 3D printed and tried in the patient's mouth. This is the APT, which you still have a chance to play with it before you prep the teeth. And then if it's okay, then go ahead with the final porcelain veneers. So I happened to lecture in Singapore 2 weeks ago, and 2 dentists were very interested on how we do this Rebel. And these 2 cases are done within 6 hours in their practices. So I was there only for half a day for my free time. This was one of the associates that the dentist had. And what we did is just declare the incisal edge position, get these 5 pictures, which I'll show you very simply how to make it. Smiling, lip letters, 12 o'clock, retracted and retracted closed. All you need is only these 5 pictures. And after these 5 pictures, the questionnaire and scanning of the mouth with 1 single mock-up. So this is the STL file you'll be getting. Immediately you can see the final outcome. 3D printing, application of this to the mouth, and the final result. Now I'll tell you one other very sophisticated part of this program when I back it up. Look at this. Do you see these dots here? These are the points that you use for Invisalign. So normally, if I would make the lab prepare a wax up for them to come over here, either they would need to cut them off, or I would need to cut them off to seat the tray. But here, you don't have to. It leaves everything as it is. It's only concentrated on the design. And if I'm not happy with this design, and if I want the patient to continue with ortho, here it is. Take it out, the bulls are there, continue. So this is what we got in 6 hours. I mean, the patient cannot believe it. Look at the before and after, and we did nothing. I'm not allowed to touch the patients. In Singapore, it's extremely strict. I just guided them just to make a single mock-up, and this is the before, this is the after APT. Then it's the patient's choice to continue or not to continue. Another case in Bruce Lee's office, this was the only patient we had. Now, just to show you how fast it is, and you don't need any of these sophisticated cameras to make the pictures, look what I'm doing with the patient, and the patient has no clue of what kind of pictures I will take. And if you imagine the time I'll be losing, this is not more than 40 seconds. Now, look at the 5 pictures I take. So first, I take patient smiling. This is my first picture. And then I'll take the picture lips at rest. And then, once I do this, I will ask the patient to bend the head down. You all know it. Take this 12 o'clock position. This is my third picture. and then I will ask her to hold the retractors herself and simply make two pictures. When the head is horizontal, I'll make one picture mouth open, one picture mouth closed, and 3 seconds, 2 seconds, 1 second, in 40 seconds I'm done. And you can use the software through your iPhone, which is also very, very simple. So again, with this 5 setup, when you get into the software, it's asking these pictures. These are what we got. Smiling, lips at rest, 12 o'clock, retracted open, retracted close. So with this now, Bruce Lee, who is the dentist, or the owner of this clinic, this is how he starts. He is placing a single mock-up on the central, sort of correcting it, even though I was telling him, don't go for perfection. He's a perfectionist. He wanted to do the best he can. Always sit the patient upright, face to face, decide on the incisal level. This is very, very critical. And once you have the incisal edge position ready, you will only need to scan it. I don't care which digital scanner you use. Every scanner scans it, but at the end of the day, you need an STL file. And now all the scanners does it. This goes to Rebel. Immediately you see the design. You see which teeth to be lengthened, and even towards the soft tissue, which teeth to be positioned over the soft tissues. With the yellow, you see the additions they made as the design. And then when it comes to you, and when you print it, 3D print it, this is what you get. And through this, again, the same procedure, you make the impression, you load it with Luxatemp, place it into the patient's mouth, and just like a miracle, this kind of a final result will come out within a few minutes. So this really is extremely impressive for the patient, seeing such a design, and also for you to know where to start from. And this was the picture we took right after, showing the change, not like individually this part, but as a whole on what it did on the patient's face. So in this last case, I'll show you different applications of Rebel. This patient with some spacing around her teeth. Of course, if you push it to the limits with excessive prep, okay, you will make some veneers, but I think it's ideal in such a case which the tooth is rotated, better to go with ortho. And in this case, the aim is to bring the lower incisors inside and upright the upper teeth and close the space between the central, lateral, and the canine as much as possible. I don't want it to be 100% because I'll treat the patient with veneers after all. So this is the time where is almost towards the end of ortho. So Nuno did a great job bringing the midline into position, bringing the incisal edges to a reasonable place. At this point, I'm just getting into Rebel. What do? I take the picture of this patient, upload it. These are the pages you will be seeing. It will give me the facial perception, very quick questionnaire. And then once it's completed, it tells you the combination in graphics. You don't have to do anything with this. Gets the Visage Smile design, and this is what we do. We do a mock-up on the centrals, even though she's having braces, just like I did in this implant case, and then send the STL file into the lab. And what I'm wanting is that getting the simple mock-up ever, which is like a nightmare for most of us. So this is the package I'm sending. It's all in the program itself, the STL file with the incisal mock-up, the personality test, questioning, and the 5 full-face pictures that are mandatory. So once it goes there, it will be positioned on the model. You know it, I don't need to repeat this. It gets you the best Visage Smile design in 2D, locates the position in the patient's mouth, and morphing the teeth, selecting the best teeth, and placing it into 3D and creating this STL file, and immediately this is what I'll be getting. Now, there's a problem, not a problem, obstacle here, because you see, I told you that Rebel can be resective design, meaning that it doesn't care whether there is braces, whether the teeth is rotated, it just does the ideal design and left the parts by itself. It gives me a great advantage because I can apply everything, even the tooth is rotated, but here it's almost impossible because of the braces. So what I can ask from the software is to sectionize this. When it fragments it, it gives me only the incisal 1/3, as you see here, and instead of this full STL file, I'll get only the incisal 1/3. So how am I gonna use this part in the patient's mouth? Well, when I receive this, instead of creating the impressions, 3D printing, immediately we go to CAD/CAM. We're using a soft material to mill to be fast. And once it's milled, these are the parts, I will apply it over the existing shapes of the teeth. So the teeth are not in the ideal position, but the silhouette of the smile is in the ideal position. So now Nuno will follow this to decide whether mesiodistally move the lateral, buccolingually bring it front or back, and I will also decide prosthetically the amount of incisal porcelain that I'll be layering in the incisal edge, and then accordingly depend on whether to vertically move the tooth or not. So at this stage, we also know with the visage smile concept that the tooth shape is like almost triangular. So Nuno pays attention to the angulation of the tooth, just following this. These are again very minor details, but this is how it works. So once Nuno does this correction, this is the end of the ortho procedure. What we do is we go back to Rebel. Once the braces are out, we don't need a new design. It uses the same design, but now sends it to me without the braces. That's simple. So this one is being 3D printed, impression through that, and that brings me into my second stage, which is the APT, which is the final mock-up you have to test in the patient's mouth. And when you agree with that, the decision we made in the beginning was placing veneers from lateral to lateral and partial prepless veneers from 2 to 3, K9 to K9. So again, prep through the APT, and this is what we get. Truly, truly minimally invasive. All the prep stays on enamel. Why? Because if we leave the prep on enamel, this was the research we published, the success rate goes up to 99%. I'm not kidding. But if you expose dentin, especially in the cervical area, success rate comes down to 68%. So that means in the next 10 to 12 years, a veneer out of 3 will have a problem for sure. Either micro leakage or debonding, whatever. So our aim is always to keep this preparation on the enamel. So once we finish this, we make an analog impression. We're using the pressable ceramics with micro layering, and this is how we try this in, after trying how we bond it. Not always we use rubber dam, to be honest, but if we feel like it's gonna be better, we use rubber dam. If not, we use it with a sectional rubber dam. So at this moment, we came out with another idea which became serious, and this Style Italiano created a project on this which is called Veneer Me. What I designed was a simple box that will help you receive the veneers from the lab and use it during your treatment of veneers. So when you open this, there's a mesh on top of this and a very, very sticky pad which won't allow the veneers fall down. You'll have the numbers in the middle, which corresponds to the tooth you're working with, 12, 11, whatever you name, and see how sticky it is. It never moves. See, it bends the Q-tips. And then, once you have this, for example, you'll do etching. Without removing anything, you do the etching. It's already sticked, but you cover it up with the strong mesh on top of this and start washing it out. And when you wash it out, nothing moves. You don't mix which one was it, 11, 21, especially in the lower, it's extremely important. And then you use the same box, converting the cup, the cup into an alcohol bath. Just screw this in, and when it's screwed, the alcohol doesn't come out. Just put it as it is into the ultrasonic bath. So we make the ultrasonic cleaning, and when it comes out, just dry the area a bit, because when it's wet, it may be slightly less sticky. Still, I mean, even that's enough for me, but if we use a hair dryer, again, it's very sticky there. Then you apply your silane, bonding, all in the same place, and just deliver it to the dentist with this cup, without touching the veneers anymore. So this was a joke like we started, but now it turned out to be a product. So anyways, if it will help you, we use it all the day in our office. So this is the veneers. We came out with the Rebel. We're using the micro-layering technique, as I told you. These are the veneers in the mouth. You see on the left before, and then ortho and Rebel design. And again, in this case, what we did only was defining the incisal edges of the two centrals. And this is the change, just digital. Now, at this point, you know, it's, if you go to Rebel Dental, you'll find all the information. But just before I finish my lecture, we like dreaming things. We like inventing things. If you go the difficult path, you come up with ideas. So Rebel was the intermediate stage. What I will say, if you ask me what is next, the next thing is again started like a dream. Now it's semi-dream, because we got the report of, yes, this can be done. And this is the new robot that we're building up through this design, which will be prepping the teeth automatically, as precise as anybody would do. So I see that this will be one of the futuristic things in dentistry. So Florian, thank you so much for inviting me here. Thank you for all of you staying here all day long. Hope to see you some other time.
Thank you, Dr. Gurel. As always, you are a visionary and you are pushing the boundaries of dentistry. Thank you for coming to our event.
Thank you.
And I invite you to lunch. See you in 1 hour.